People who are struggling with obesity struggle with obesity for the simple reason that they're doing what their bodies and their minds were designed to do, which is respond to the food environment. I believe in my heart of hearts that conditions such as obesity are solvable, but they're only going to be solvable if we take a collective integrated system approach. There is no silver bullet answer in all of this.
36% people in the United States are obese, another 33% are overweight, so that's now 70% of people are unhealthily overweight. Or to put it another way, it's normal to be unhealthily overweight in America today. And if it's normal, it means the problem is not within individual people. It means that we have normal people in an abnormal environment. This is a global pandemic at this point, and it's been estimated now that there will be more deaths this year globally from obesity than from starvation. So for people who say, well, the government shouldn't be involved. If we shouldn't be involved with this health problem that's affecting 70% of Americans, killing 100,000 people per year, then what is your threshold for when the government should be involved? Is it 75% or is it 80%? Because if we do nothing, we'll get there. And so, okay, then maybe we should wait till we get there. But we're going to cross that threshold sooner or later, no matter what you set it to be.
Should the government solve the problem or should individuals? It's a personal responsibility. And I believe that we really, really handicap ourselves when we limit ourselves to two options like this. So when we talk about the government coming down like this, okay, well, that's one solution. We talk about individual responsibility coming up like this to fight the obesity problem. What we don't often look at are all the things that can come in from the side. Those things from the side can be win-win options that companies have seen that they haven't considered before, whether it be the 100-calorie pack, helping people eat better, but they made a lot of money on it. Whether it be the McDonald's Happy Meal, healthier, but they're making a lot of money on it. That's the option we don't often see, and I think that's when it's overlooked, when we have this duality of government, personal responsibility.
Why wouldn't there be a role for regulation of industry to say 100-calorie packs is a good idea? You need to do that across all of your product offerings.
Well, because the restaurant doesn't want us to eat more. They want us to eat there and not at Joe's across the street. I think that's what we need to keep in mind. Is their motivation is not to make us fat, it's to make us spend money.
How have you been thinking about changing the incentives within your employee base to encourage better health?
We do use incentives across different programs in diabetes. In obesity, we have contests, and we ran a program last year that we called Walk This Way. We asked our employees for 12 weeks to wear a pedometer, and we incented them $200. And what we found is 18,000 employees signed up. We walked about 7 billion steps, which is I don't know how many times back and forth from the moon. The level of awareness of people's physical activity went up an enormous amount. Example number 2, partnering with Weight Watchers, we wanted to have a healthiest location competition, and the location that had the highest prevalence of increase would eventually have a award ceremony that would be hosted by one of Weight Watchers' spokespersons, Jennifer Hudson. One woman sent in a letter, and it was there were stacks of potatoes. It was a picture, and it said, "Thank you for the Weight Watchers program." She said, well, my husband wanted me to send this in because this is the amount of weight I lost using Weight Watchers, and it can really help me work, be with my grandchildren a little bit more. Made me feel great. Both the financial data and the non-financial data really encourage us to do these types of programs.
People are really excited about the role of mobile tools, mobile health in all areas of healthcare. And I'm wondering, Dr. Volp, whether you've seen any evidence that the use of mobile tools has been effective in bridging that gap between a patient's intention and the way they actually behave.
I think with many of these apps, we just don't know. There is a lot of work that is being done by our group and others where we have given people access to home-based wireless scales or employer-based wireless scales, and we're finding that the combination of the technology, which allows for frequent ongoing feedback, that is very helpful. It's just that people are much more wired to focus on the present, and if we think about premium adjustment as a paradigm for this, I'm very concerned that that sort of intermittent feedback, which comes at more distant time intervals, just isn't that effective.
I'll talk about the soft drink tax. We did this study in Utica. We got 3 of the Hannaford restaurants in Utica, New York, to do an 8-month study where we taxed soft drinks 10%. One of the things we found is that for the first month, it made a little bit of difference. For the next 5 months, it made no difference at all. The problem is, what happens if you don't buy soda? Do you just stop drinking? Maybe you drink something else. Beer drinking households ended up drinking a lot more beer during the month where they drank less pop. So that paper's under review now. It's called From Coke to Coors.
The whole issue of unintended consequences is real. We often don't know what's going to happen when we play something out. But it also was sometimes raised by people who just don't want to change.
That's right.
And I think we should have a bias towards action rather than a bias towards caution.